Hello, we're Wellbeing for Us, a digital wellbeing platform designed for you. We offer one-to-one support, workshops, advice and mental health awareness. In today's webinar, we are going to be discussing borderline personality disorder. If you feel affected by anything discussed today, please get in touch with us. In addition, at the end of the webinar, there are also helpline numbers you can ring that are completely confidential. Please reach out for help if you feel uneasy or feel like you may be suffering. These are all our social media contact details. So, borderline personality disorder, also known as BPD, is a disorder of mood and how a person interacts with others. It is the most commonly recognised personality disorder. In general, someone with BPD will differ significantly from an average person in terms of how he or she thinks, perceives, feels or relates to others. So the main symptoms of BPD can be grouped into 4 different main areas, which you'll find in a minute. So these symptoms of a personality disorder may range from mild to severe and usually emerge in adolescence, persisting into adulthood. So these are the 4 main areas of where the symptoms are grouped. So you've got emotionally instability, disturbed patterns of thinking or perception, impulsive behaviour, and intense but unstable relationships with others. So the causes of BPD are unclear, but as with most conditions, BPD appears to result from a combination of genetic and environmental factors. So people with borderline personality disorder may come from many different backgrounds, but most will have experienced some kind of trauma or neglect. So knowing when to get help is really important. That if you feel like you're struggling, you reach out, contact a loved one, contact your GP. So if you're experiencing symptoms of BPD, make an appointment with your GP as soon as possible. They won't judge you at all. It's a complete safe space and you may be able to open up and talk about how you're feeling. They may ask how you feel, your recent behaviours and what sort of impact your symptoms is having on your quality of life. How is it affecting your day-to-day life and your routine? This is also to rule out any other common mental health conditions such as depression, anxiety, and to make sure there's no immediate risk to your health and well-being. So please do contact someone if you feel like you need help. Diagnosis. So if your GP suspects you have BPD, you will likely to be referred to your local community mental health team for a more in-depth assessment. So the team will help you and they'll be there for you to support you and give you advice and work through it with you. Some teams may focus only on people with psychotic disorders, but there will be someone that is specific and will help you specifically. So there are complex needs services that are better placed to help you. Your assessment will be carried out by a specialist in personality disorders, so these usually involve either a psychologist or a psychiatrist. So the assessment for borderline personality disorder is internationally recognised criteria, so used all over the world to help diagnose BPD. And the diagnosis can usually be made if you answer yes to 5 or more of the following questions. So we'll go through these questions together over the next few slides and note down if you've said yes to any of them. And if you have, then please contact your GP, definitely. So one of the first questions involved in the assessment is, do you have an intense fear of being left alone, which causes you to act in ways that on reflection seem out of the ordinary or extreme, such as constantly phoning someone? The second question is, do you have a pattern of intense and unstable relationships with other people that switch between thinking you love that person and they're wonderful to hating that person and thinking they're terrible? The third question is, do you ever feel you do not have a strong sense of your own self and are unclear about your self-image? The next question is, do you engage in impulsive activities in two areas that are potentially damaging, such as unsafe sex, drug misuse, or reckless spending? Next, have you made repeated suicide threats or attempts in your past and engaged in self-harming? Do you have a severe mood swing, such as feeling intensely depressed, anxious, or irritable, which last from a few hours to a few days? Do you have long-term feelings of emptiness and loneliness? Do you have a sudden and intense feeling of anger and aggression and often find it difficult to control your anger? When you find yourself in stressful situations, do you have feelings of paranoia, or do you feel like you're disconnected from the world or from your own body, thoughts, or behaviour? So if you answered yes to 5 or more of them previous questions, you may possibly have borderline personality disorder, so please contact your GP for further guidance, help and assistance, and they can direct you to the right route for you. So after your diagnosis of BPD, it's really important to involve your family and your loved ones, people you trust. They can be there for you, and this can help your recovery of BPD, as BPD affects your relationships with people close to you, so involving them in your treatment may make them aware of your condition and make your treatment more effective. Obviously, it's completely up to you who you tell, and everything that you say and everything that is involved around you is completely confidential and anonymous and will be respected at all times. So, treatments. There are a wide variety of different treatments for borderline personality disorder, so we'll go through them over the next few slides. So, community mental health team is a very effective treatment for BPD, and it can be made up of social workers, mental health nurses, psychologists, psychiatrists, and therapists. CPA is also another effective form of treatment for BPD. So there are 4 stages of the care program approach. Psychotherapy is also a very effective treatment for BPD, which involves types of psychological therapy, and there's lots of different types, but they all involve taking time to help you to get a better understanding of how you think and feel. So psychotherapy for BPD is only delivered by trained professionals. So these include psychiatrists, psychologists, or other trained mental health professionals. Dialectic behavioural therapy is also a different type of treatment for BPD, and it is designed to treat people specifically with BPD. It's based on the idea that two important factors contribute towards BPD, so emotional vulnerability and also the environment. These two factors may cause you to fall into a vicious cycle. You experience intense and upsetting emotions, yet feel guilty and worthless for having these emotions. So DBT will help combat this by using validation and dialectics. The DBT therapist will use both concepts to try and bring about positive changes in your behaviour. Another form of long-term psychotherapy treatment for BPD is mentalization-based therapy, also known as MBT. So this helps to recognise that other people have their own thoughts, emotions, beliefs, wishes and needs, and your interpretation of other people's mental states may not be necessarily correct. They may be a false reality, and they may not be actually true. So people do love you, people do care about you, even if your brain is telling you otherwise. So MBT is usually first delivered in a hospital, and then you would stay there as an inpatient. So this consists of daily individual sessions with a therapist and also group sessions, which are also really effective. Therapeutic communities are also another treatment for BPD, which is also really helpful, and they're designed to help people with long-standing emotional problems and a history of self-harming. As well as taking part in the group therapy and individual therapy, TC also includes designing to improve your social skills and self-confidence. So these can include doing daily tasks that will benefit you and help achieve a happier and healthier you. So these include normal chores, meal prep, exercising, recreational activities, sports, and also regular community meetings, talking about how you're feeling and discussing any issues that are affecting you daily. Art therapies are also very beneficial for BPD. So these include dance movement, drama, music, painting, creative, all things art that will help you. So this is really important therapy for people that find it really hard to express their thoughts and feelings through words verbally, and that can be conveyed through art instead. So painting how you're feeling, and a therapist will help you relate to what this means, your thoughts and experiences, and will deepen your understanding about who you are and how to help you and your BPD. With many people that are diagnosed with BPD, there are also other associated mental health problems. So these include depression, anxiety, bipolar, eating disorders. Please watch our other webinars if you feel like you may be suffering from depression or anxiety or eating disorders, as we have webinars tailored specifically to each of them mental health issues, and they may help you and also deepen your understanding. We really hope we've helped you today. If you are struggling, please reach out for help and speak to someone, whether that's Wellbeing for us or a loved one. We know it's so tough opening up, but it will make you feel so much better. On the next slide, there are some phone numbers of mental health helplines. These are completely confidential and just a way to speak about how you are feeling, and they can direct you to the right place, offer you advice, and most importantly, support and help you. So please call or text one of the following numbers if you are struggling with your anxious thoughts and are worried about anything at all. We are all here to help you. Thank you so much for watching and listening today. Get in touch at wellbeingforus.com. We offer one-to-one support with therapists and psychologists and offer workshops and advice for you. Also, feel free to get in touch with us on our socials. We love to have a chat and are always only ever a DM away. Take care. Bye, everyone.